My name is Emerson McCain from Andrews University, Department of Sustainable Agriculture, and I'm here today to talk to you about goat health. To prevent internal parasites, be sure to regularly monitor your goats for the previously mentioned signs of an unhealthy goat. Blanket deworming is administering deworming agents to all of your goats at once, and it is not recommended. Over-deworming can cause resistance to the medication. Instead, identify goats that need deworming. The FAMACHA scoring system can help determine which goats require treatment. Again, pale eyelids can indicate anemia, which is often a sign of parasites. Goats can also suffer from external parasites, such as lice and mites. Good management practices like regular cleaning and disinfection of the barn or shelter can help prevent infestations. If your goats do experience an infestation, treatment may involve topical or systemic medications. Consult your veterinarian if possible. If you're unable to do this, administer medications as needed. Now, let's talk about vaccines. So the most important vaccination you're going to want for your goats is the CDT vaccination. This will help protect them against enterotoxemia as well as tetanus. Some other important vaccines to consider are the pneumonia vaccine. This will help protect them against pneumonia, as well as the chlamydia vaccine to prevent chlamydial abortions. I'm going to include a chart that will discuss the schedule as well as when to administer these vaccinations, as well as some other important vaccines you can consider. The two most common ways to administer vaccines to your goats is subcutaneous injection under the skin and intermuscular injection into the muscles. For a subcutaneous injection, as we see here, pull a section of loose skin to make a tent-like fold and then inject into the base of the tent. You want to avoid poking through the skin and shooting out of the other side. The other common method, intermuscular, or again, into the muscles, will require a longer needle than subcutaneous injection, about 1 to 1.5 inches. There are two great places for an intermuscular injection. One is at the base of the neck in front of the shoulder. We call this the triangle area. And the second, and what we see here, is on the back side of the goat above their tail. Be sure to always use a clean needle to avoid infection. This graphic here highlights some of the areas where you can do the intermuscular, or IM, on this graphic, and the subcutaneous, or SQ, along the neck region, towards the back of the animal for the intermuscular, and then in that triangle region that we see towards the front.